What impact does Ra have on your overall lung function? Imagine your lungs working smoothly to bring in fresh air and send oxygen to your body. Rheumatoid arthritis can sometimes interfere with this process in surprising ways. Because Ra is an autoimmune disease, it can cause inflammation not just in your joints but also in other parts of your body, including your lungs. This can lead to several lung problems that affect how well your lungs work. One common issue is called interstitial lung disease. This involves inflammation and scarring of the lung tissue, which makes it harder for your lungs to expand and for oxygen to pass into your blood. About 10% of people with rheumatoid arthritis develop this condition, and it can be serious. Symptoms like shortness of breath, a persistent cough, and fatigue often get worse over time. Because of the scarring, the lungs can't do their job as efficiently, which can reduce your overall lung capacity and make breathing more difficult. Another issue involves small growths called pulmonary nodules. These are usually harmless but can sometimes cause symptoms or be signs of lung involvement by Ra. Fluid can also build up around the lungs in a condition called pleural effusion, which can make it harder for your lungs to fully expand when you breathe. This fluid buildup can cause chest discomfort and shortness of breath. Damage to the airways can happen too, leading to conditions like bronchiectasis, where the airways become abnormally widened. This can cause recurrent infections, a chronic cough, and obstructive lung patterns that make airflow difficult. Studies show that even people who do not smoke have an increased risk of both restrictive lung diseases, which limit lung expansion, and obstructive diseases, which block airflow. Certain medications used to treat Ra can also affect your lungs. Some drugs may cause lung toxicity, adding to the risk of lung problems. Because these issues can develop gradually and sometimes without obvious symptoms, regular lung function tests are important. These tests can measure lung volumes and how well oxygen is transferred into your blood, helping detect problems early. Risk factors for lung disease in Ra include having certain autoantibodies like rheumatoid factor or anti-CCP antibodies, being male, smoking, and having the disease for a longer time. If you notice symptoms like shortness of breath or a persistent cough, or if you have risk factors, talking with your healthcare provider about lung monitoring is essential. In summary, rheumatoid arthritis can impact your lungs in many ways, from inflammation and scarring to airway damage and fluid buildup. These changes can reduce how much air your lungs can hold, how well you can breathe, and how effectively oxygen reaches your blood. This can lead to symptoms that affect your daily life and overall health. Early detection and proper management are key to protecting your lung health. Always consult your doctor for personalized advice and regular checkups to keep your lungs as healthy as possible.